Does that pins and needles feeling in your hands sometimes make you stop and wonder what exactly is going on? Maybe it's when you wake up in the morning and your hand feels asleep. Or after you've been sitting and reading for a while. Or maybe it just seems to come and go without much warning. That tingling. Or sometimes a bit of numbness. In your fingers, palms, or even running up your arm. Can be a bit unsettling. Can't it? It's a strange sensation, and it's perfectly natural to feel a little concerned, especially as we get a bit older and our bodies seem to have their own little quirks pop up more often. While it's true that often this feeling is completely harmless and goes away on its own, sometimes, just sometimes, it could be your body gently trying to tell you something important. Ignoring these signals, no matter how minor they seem, isn't always the best approach, but understanding what they might mean can give you peace of mind or prompt you to take helpful steps. In this video, we're going to explore some of the common reasons your hands might be tingling, especially as we navigate life after 60, and why paying a little attention is key. We'll look at a few different possibilities, from the very simple to things that might need a doctor's input. Stay tuned, because understanding this sensation could lead to insights about your health that might surprise you. Now, let's dive right into some of the most common reasons you might experience that tingling sensation in your hands. Often, the simplest explanations are the right ones. Think about this. How much time do you spend with your hands or arms in certain positions? Maybe you sleep on your side with your arm tucked awkwardly under your pillow or your head. Or perhaps you're engrossed in a good book or working on a computer, and your wrists are bent or resting on a hard surface for an extended period. What happens in these situations is that you're putting pressure on the nerves or blood vessels in your arm or wrist. Nerves are like tiny wires that carry signals back and forth between your brain and the rest of your body. When a nerve is compressed or squashed, it can't send those signals properly. It's like stepping on a garden hose. The water flow gets interrupted. The tingling sensation is often the nerve protesting, or, sometimes, it's the feeling returning as the pressure is released and the nerve starts working normally again, sending a burst of signals. This temporary nerve compression is incredibly common and usually isn't a sign of anything serious. It's the classic limb falling asleep feeling. It might be slightly more frequent as we age because our circulation might not be quite as robust. Or perhaps we spend more time in settled positions. The good news is that this type of tingling almost always resolves quickly once you change your position. If you notice it happens after you've been holding your phone for a long time, or when you're sitting in a particular chair, try adjusting how you sit or hold things. Simple awareness of your posture and positions can make a big difference. But what if the tingling happens even when you don't feel like you've been putting pressure on your hand? Another very common culprit, and one that often goes overlooked, is related to your body's fluid balance and general health. Sometimes, dehydration, even mild dehydration, can affect how your nerves function and how your blood circulates. When you're not properly hydrated, your blood can become a bit thicker, making it harder for it to flow freely, especially to your extremities like your hands and feet. This reduced blood flow means your nerves and tissues aren't getting quite as much oxygen and nutrients as they need, which can sometimes manifest as a tingling sensation. Are you drinking enough water throughout the day? It sounds simple, but it's surprising how many of us don't. As we get older, our sense of thirst can diminish, meaning we might not feel thirsty until we're already a bit dehydrated. Medications many of us take can also sometimes contribute to dehydration. Making a conscious effort to sip water regularly throughout the day, even when you don't feel parched, can improve your circulation and overall nerve health. Juices, herbal teas, and water-rich foods like fruits and vegetables also count towards your fluid intake. It's such a basic thing, but ensuring you're well hydrated is fundamental to so many bodily functions, including keeping those nerves happy and quiet. Beyond simple pressure and hydration, let's think about what else nerves need to work properly. They need nourishment. not just from blood flow, but from specific nutrients. One common nutritional reason for tingling hands, particularly in older adults, is a deficiency in certain vitamins, especially B vitamins, like B12, B6, and folate. Vitamin B12 in particular is absolutely crucial for nerve health. It plays a key role in forming the protective sheath, called myelin, that surrounds nerve fibers. Think of myelin as the insulation on those electrical wires we talked about. If the insulation breaks down, the signals can get scrambled. A deficiency in B12 can cause this myelin to deteriorate, leading to nerve damage, or neuropathy, which often starts with tingling and numbness in the hands and feet. Our ability to absorb vitamin B12 from food can decrease as we age, sometimes due to changes in stomach acid or because of certain medications. Conditions like pernicious anemia also affect B12 absorption. Unlike temporary pressure, tingling from a vitamin deficiency tends to be more persistent and might worsen over time. If you suspect a vitamin deficiency, perhaps because you follow a vegetarian or vegan diet without supplementing, or if you've had digestive issues or surgery that affects nutrient absorption, it's really important to talk to your doctor. A simple blood test can check your vitamin levels, and if they're low, supplements can often reverse the symptoms, though it might take some time. Don't just guess and start taking high doses of vitamins. Though, too much of some vitamins, like B6, can actually cause nerve problems. Always check with a healthcare professional before starting any new supplements, especially high-dose ones. They can guide you on the right type and amount if needed. Moving on from temporary issues and nutrients. Sometimes the tingling points to a specific physical issue affecting the nerves in a very targeted way. One of the most well-known conditions causing hand tingling is carpal tunnel syndrome. Have you heard of that? It's very common, especially among people who do repetitive hand or wrist movements. But it can also develop without an obvious cause, sometimes linked to fluid retention or inflammation. The carpal tunnel is a narrow passageway in your wrist, sort of like a tunnel made of bones and ligament. Several tendons that help you bend your fingers pass through this tunnel, along with the median nerve. This nerve is responsible for sensation in your thumb, index finger, middle finger, and half of your ring finger, as well as some movement in your thumb muscles. If the tissues within this narrow tunnel become swollen or inflamed, they can compress the median nerve. This compression leads to symptoms like tingling, numbness, pain, and sometimes weakness in the part of the hand the median nerve serves. The tingling often feels worse at night, sometimes waking people up, and might be relieved by shaking the hand. It can also be triggered by activities that involve bending the wrist, like driving or typing. If you're experiencing tingling primarily in the thumb, index, middle, and ring fingers, and especially if it's worse at night or with certain activities, carpal tunnel syndrome is a strong possibility. There are various ways to manage it, from wearing wrist splints, especially at night, to physical therapy, steroid injections, and in some cases, surgery to relieve the pressure on the nerve. But getting a proper diagnosis is the first step. A doctor can perform physical tests and sometimes recommend nerve conduction studies to confirm if it's carpal tunnel syndrome or something else. Another related condition, though less common than carpal tunnel, is cubital tunnel syndrome. This involves the ulnar nerve, which is often called the funny bone nerve because you feel a shock when you bump it at your elbow. The ulnar nerve travels down your arm and passes through a tunnel near your elbow before going into your hand, where it provides sensation to your little finger and the other half of your ring finger, as well as controlling some small hand muscles. Just like the median nerve in the wrist, the ulnar nerve at the elbow can become compressed or irritated, especially if you lean on your elbows a lot, or if the nerve is stretched when you keep your elbow bent for extended periods, like while sleeping or talking on the phone. The tingling and numbness from cubital tunnel syndrome are typically felt in the ring finger and little finger. You might also notice weakness in your grip or difficulty with fine motor skills in that hand. If your tingling is focused on those outer two fingers, Thinking about cubital tunnel syndrome makes sense. Treatment often involves avoiding activities that aggravate the nerve, wearing an elbow splint at night to keep the elbow straight, and sometimes physical therapy, or, in more severe cases, surgery to relieve the pressure. Again, paying attention to exactly where the tingling is occurring in your hand is a big clue for your doctor to help figure out the cause. Is it the thumb side, the pinky side, or all over? This detail matters significantly. Now, sometimes the source of the tingling isn't just in the hand or wrist or even the elbow, but further up, perhaps in the shoulder, neck, or even the spine. Nerves that go down your arms originate from the spinal cord in your neck. Issues like pinched nerves in the neck, often caused by conditions like osteoarthritis, wear and tear on the spinal joints, herniated discs where the cushion between vertebrae bulges and presses on a nerve, or spinal stenosis, narrowing of the spinal canal, can cause symptoms that travel down the arm into the hand. This is often called cervical radiculopathy. The tingling or numbness from a pinched nerve in the neck might be accompanied by neck pain or stiffness, pain or weakness radiating down the arm, or symptoms that worsen when you move your neck in certain ways. It can affect different parts of the hand depending on which specific nerve root in the neck is being compressed. For instance, a pinched nerve higher up in the neck might affect different fingers than one lower down. Diagnosing this usually involves a physical examination, discussing your symptoms and how they relate to neck movements, and sometimes imaging tests like X-rays, CT scans, or MRI scans of the neck. Treatment can range from physical therapy, pain medication, steroid injections, or in some cases, surgery. If your hand tingling comes along with neck or shoulder pain, or seems related to neck movements, it's definitely worth discussing the possibility of a cervical spine issue with your doctor. It highlights how interconnected our bodies are. A problem in your neck can literally be felt all the way down in your fingertips. Another systemic issue that can cause tingling hands, and something that becomes more prevalent as we age, is diabetes. High blood sugar levels over time can damage nerves throughout the body, a condition known as diabetic neuropathy. This type of nerve damage most commonly affects the nerves in the feet and legs, but it can also affect the hands and arms. Diabetic neuropathy often starts subtly, perhaps with mild tingling or numbness, and can progress to burning pain, increased sensitivity to touch, or loss of sensation. It typically affects both hands and feet symmetrically if you have diabetes, especially if it's not well controlled. Tingling hands should definitely prompt a conversation with your doctor. Managing your blood sugar levels is the most important step in preventing further nerve damage and can sometimes even improve symptoms. But it's not just diabetes. Other chronic conditions can also affect nerve health and circulation. For example, thyroid problems, particularly an underactive thyroid hypothyroidism, can sometimes cause nerve symptoms, including tingling, kidney disorders, liver disease, autoimmune diseases like rheumatoid arthritis or Sjogren's syndrome, and even certain infections can, in some cases, lead to nerve damage or compression that results in tingling or numbness. This is why it's so important to look at the whole picture of your health and discuss all your symptoms with your doctor. They can consider your overall health profile, medical history, and any other conditions you have to help pinpoint the potential cause of your tingling hands. We've covered quite a few potential reasons for tingling hands, from simple positional issues and dehydration to vitamin deficiencies, specific nerve compressions like carpal tunnel and cubital tunnel syndromes, and more systemic conditions like issues originating in the neck or related to diabetes and other chronic illnesses. It might seem like a long list, and perhaps a bit overwhelming, but the key takeaway is this: tingling hands, while often benign and temporary, can have many different underlying causes. It's your body's way of signaling that something isn't quite right, whether it's just a temporary pressure on a nerve or something that needs medical attention. Trying to self-diagnose based on a video or internet search isn't the most reliable approach. While understanding potential causes can be helpful in deciding if and when to seek help, only a healthcare professional can properly evaluate your specific symptoms, consider your medical history, perform necessary tests, and give you an accurate diagnosis. They can help determine if your tingling is due to something simple and easily corrected, or if it requires treatment for an underlying condition. Remember, small changes in sensation or function, even something as seemingly minor as tingling hands, are worth paying attention to as we get older. Our bodies are complex systems, and these sensations can be valuable clues. Don't dismiss it as just getting older without considering what might be going on. Being proactive about understanding what your body is telling you is one of the best things you can do for your health and well-being. Whether your tingling is occasional or constant, mild or bothersome, or accompanied by other symptoms like pain, weakness, or changes in sensation elsewhere, discussing it with your doctor is always the right step. They are your partner in navigating your health journey. It might turn out to be something very simple, giving you peace of mind. Or, if it is something that needs treatment, catching it early is almost always better. Don't hesitate to bring up your concerns. We hope this discussion has shed some light on the possible meanings behind tingling hands after 60. It's about being informed, not alarmed. Understanding the potential causes empowers you to have a more productive conversation with your doctor and advocate for your own health. Have you experienced tingling hands? Do you have any insights or experiences you'd like to share? Your comments can be incredibly helpful to others in this community who might be experiencing something similar. Please feel free to share your thoughts below. And if you found this video helpful or interesting, please give it a thumbs up. It really helps our channel reach more people who might benefit from this information. And don't forget to subscribe to our channel and hit that notification bell so you don't miss out on future videos packed with practical tips and information to help you live your best life at every age. We're here to explore all sorts of topics related to health and well-being as we embrace this wonderful stage of life. Thank you for watching. And remember, taking care of yourself is always in style. Live your best life at every age.